So children can ingest solid foreign bodies, which are your coins, your beads. They can ingest liquid foreign bodies, which are your bleaches and your cleaners. And it's extremely important that if you're going to put anything in any container, you label that container, this contains bleach, and you want to put it in shelves where children cannot reach. So put it way above in shelving that or in cupboards that children cannot open.
Hello everyone, I'm Francisca, your co-host of Pediatrics to Go, and welcome back to our channel. Today we're talking about accidental ingestion of foreign bodies in children, and your trusted pediatrician will be taking the floor as usual. Hello, Dr. Sanusi, how are you doing today?
Hi, Francisca. I feel it's going to be very short, but very to the point. Foreign body ingestions. We see a lot of foreign bodies being ingested by children, especially between the ages of 2 years old and 5 years old, and that's because they're explorers. We see older children ingesting foreign bodies. What are the commonest foreign bodies we see? Coins. A lot of children hide beads in their mouth. They hide coins in their mouth, and many times they don't intend to, but they swallow. And when they swallow it, parents come and say, I think she swallowed a coin or something. Now, when children have coins or anything that they're swallowing, what we always recommend when we see parents is the safety of the home. So you don't want little things, especially when children start to crawl, everything goes in their mouth. Children pass through a phase where they want to taste everything because they feel that everything should have a taste, and that's part of exploring. That's part of the brain learning. So when they put things in their mouth, it's all part of their development. So we tell parents, first of all, things like cover your electrical outlets because children want to explore. They want to put things in the wall, or make sure you don't put like all these cleaners like bleach and stuff inside regular food bottles or inside regular, because there's some cleaners that are purple in color. They look like juice. Children want to drink it. So children can ingest solid foreign bodies, which are your coins, your beads. They can ingest liquid foreign bodies, which are your bleaches and your cleaners. And it's extremely important that if you're going to put anything in any container, you label that container, this contains bleach, and you want to put it in shelves where children cannot reach. So put it way above in shelving that or in cupboards that children cannot open. And that comes to child safety locks that you want to use. So when a child comes in and there's a history of ingestion, we want to ask, was there any vomiting? Was there any difficulty breathing? Because when a child ingests, the airway is in front, the food pipe is at the back. Sometimes they can ingest and it goes into the airway. And first thing we do is what we call a nose to rectum. Basically, you're doing x-rays of the nose. So you're taking an x-ray of the face, the neck, the chest, and the abdomen. Because when a child ingests a foreign body, it could be stuck in the neck if it's a coin. If it's a big coin, especially, and the child's airway is small, it could be stuck in the esophagus, and it could be stuck in the stomach. But most times, if it's in the stomach, we're actually relieved. It's like, that means that the coin is not stuck in the airway, which can cause respiratory distress. And that child, if the coin is laying like this, that can cut off the airway, the air supply for the child, and children can die like that. So it's extremely important, if there's any history of difficulty breathing and your child has swallowed a coin, you want to go to the nearest emergency room, because that can be a potentially fatal condition where if the coin, the airway, remember the airway is like a straw. If the coin is laying like this and it's stopping air from moving, that child can easily die. Most children, in general, it's more common to see coins that are stuck in the food pipe. So if it's in the air, if it's in the esophagus, which is just around the neck, those children need to have a bronchoscopy. Basically, that's a scope where they go to the surgeons. The surgeons have to put in a tube with a camera, and they also have, through that tube, they can actually go in and take the coin out and bring it out. And that's what a CT surgeon would do, like a cardiothoracic surgeon, because that's what they're trained to do. Now, if it's in the stomach, we're like, that's the best way it could be, because it will take an average of 24 to 48 hours, sometimes 3 to 4 days. If the child poops regularly every day, the child can pass that foreign body out within 1 to 2 days. But if the child is a bit constipated and there's just a lot of starchy or hard stools in the intestinal tract, then it might take up to 3 to 4 days for the coin to pass. But as long as that coin is passed, there's nothing to worry about. Now, if the child starts to have symptoms of obstruction where the coin is stopping the food from moving, remember, if there's an obstruction in the gut, the child will start to vomit, because that means food cannot pass where the coin is. or the foreign bodies, and then they might end up having bloating because if their stomach is kind of like blocked, nothing is going to pass. So they start to bloat, they start to vomit. Those children might need an endoscopy where they put a tube down the food pipe, go in there and take the coin out. But generally, when it's a coin, it comes out, or if it's a bead, it comes out and everybody's happy. When we do the nose to rectum, we're also checking the lungs to make sure that there's good aeration in the lungs, to make sure that there's no foreign body blocking the air movement for the lungs. A lot of children, sometimes if they ingest even things like peanuts, we've had children that have had peanuts in their lungs. The X-ray might have decreased aeration or increased aeration because there's air trapping in that lung. And most foreign bodies will go into the right, because where you have the right main stem, which are the food pipes, going down like this, the left goes this way. So if something is being inhaled, a foreign body gets into the lungs, it will be in the right main stem, which is on the right side. Usually it will not go to the left, sideways. It will go straight down the path of least resistance. So if there's a foreign body in the right lung, that could cause respiratory distress. Those children also need to see a cardiothoracic surgeon who would go in there and take it out with using a bronchoscope, and they'll take it out and the child should be fine. So please, please, please keep your child safe. No foreign bodies on the floor, no drinks or liquid like bleaches and stuff in bottles that are not labeled. And it's always safe to put away all your cleaners far away where the children cannot find it. Now, if it's a liquid ingestion, in the US, we have the Poison Control Center where we call and say, hey, I have this. What do I do? What do I expect? If it's something like soap, for instance, we want to make sure that we also do the nose to rectum to check the lungs. But if it's a liquid like soap, usually the Poison Control Center will tell you what to do. They would say, okay, give the child water to drink to dilute. Remember, if it's soap, it's going to be bubbly. Sometimes they can throw up and it'll be full of foamy liquid. But things like bleach, those are alkaline liquid solvents, and they can start to dilute the intestinal wall. So it can be very dangerous. Things like batteries, that's an emergency, because a battery can burn through the mucous membranes into the muscles of the GI tract and create holes in the gut. So those are things we don't. Magnets can cause, a magnet can go around and travel, and it can cause abnormal blockage of the intestine. So if they've swallowed batteries, especially your flat watch batteries or any flat batteries, that's dangerous, because those batteries have chemicals in there that can burn the gut and cause a big hole in the gut. That's an emergency. Those batteries need to be removed. If there's magnets that the child has swallowed, that's also an emergency, because those magnets will end up clumping the gut and create an artificial blockage of the intestines. So go to your nearest university hospital where all the big theaters are, where the surgeons are, where all the specialists are. That's not where you want to go to your pediatrician's office and say, oh, I have blockage. Go to the nearest emergency room in the biggest hospital near you, preferably a university hospital, where they can go ahead and treat your child according to what your child has ingested, and they can give you the best care that you need.
So what of cases like here in Africa, like in Nigeria specifically, where you have children ingesting kerosene by mistake, sometimes get palm oil. So what's the relationship between palm oil, our grandmas?
That's a very good question.
What's the relationship between palm oil and, all these poisonous liquids? What does it do to the child before, healthcare comes in?
Well, there's all kinds of liquids that can be ingested. And you're right, kerosene. Kerosene is a highly flammable liquid, and getting into the GI tract. For a child to ingest kerosene, that's an emergency too, because the problem is the child can throw up, and some of that kerosene can go into the lungs, and it can cause chemical damage to the lungs. So that's why we do a nose to rectum. Those children that have inhaled or swallowed and we're worried that there might be chemical irritation to the lungs, they need to be admitted. Some of them might need to be on oxygen, because they might end up having an aspiration pneumonia just from having basically pneumonia or infection or extreme irritation of the lungs that can cause decreased aeration, and then the oxygen would be low. So those children need to sometimes be monitored in the ICU to make sure that their respiratory status doesn't decompensate, or make sure that they don't get so bad where they can't breathe and ending up dying. So there's all kinds. We can't go into every detail of what could be swallowed, but the bottom line is, if it's a toxic chemical, you don't want to keep it where a child can find it and drink it. You don't want to put it in a juice bottle or in a Coca-Cola bottle, and they're thinking, oh, I have Coca-Cola today. You know, in the past, we had kerosene lamps that you would fill with kerosene, and then you would light it in the night. Those things are like antiques. Yeah.
Lanterns, that's all.
When we were growing up in the village, you know, I would go to Benin to visit my grandpa, and they would bring, before electricity, and those were the main lamps and lanterns, and they would have special bottles where they would keep it. But nowadays we have electricity. We do have light issues here in Nigeria, but at the end of the day, keeping those substances, prevention is always better than cure. Keep away those substances from where children can reach, and always have safety in mind for your child. Prevention is always better than cure. And that's what we want to talk about today.
All right, thank you very much. You know, they always say silence is golden, but being a parent, silence is suspicious when you have children. So you already have first-hand information in case your child, you know, accidentally swallows foreign objects or foreign bodies, and you know what to do. So until next time on Pediatrics to Go, bye.
Bye.